Hi. We see a lot of patients in our clinic who complain of shoulder pains. It could be, the pain could come on when they put on a jacket, trying to reach with the hand on one of the sleeves, or when they try to reach the back seat of the car to grab something, when they sit in front of a computer, maybe just working on the mouse. At the end of the day, they might have a shoulder pain, or even when they do some overhead work, painters, decorators, doing a lot of stuff overhead and creating a pain there. Now, it's most likely that that pain is caused by one of three diagnoses. You either might have a shoulder impingement, you might have the start or a full frozen shoulder, or you might have a rotator cuff tendonitis. Now, it's not the only things, but those are the three most common injuries to the shoulder. And what I'm going to do today and share with you is a very, very simple but effective exercise how you can self-help and self-treat your shoulder joint. This is an exercise that we give to our patients. We do some work, we could do some shockwave therapy, we can do some medical dry needling on the shoulder, we can loosen up neck and the area between the shoulder blades, we can do some stretches, and then this as a support is a home exercise. Now, actually, the exercises is all based on this book. It's called Shoulder Pain, The Solution and Prevention, and written by a guy called Kirsch, and he's done a lot of studies into shoulder problems and what to do with shoulders, and what he came up with is actually an exercise. It's a two-part exercise that's proven to be successful in 98% of these cases. So in case of a shoulder impingement, a frozen shoulder, or rotator cuff injury, even a rotator cuff injury that's confirmed with a CT scan or an MRI scan that you actually have a little bit of a tear there, the exercise I'm going to show you are very, very effective for these problems. Now, before we start, two things. One, you have to be able to lift your hand up to the horizon without too much pain. So that's number one before you start these exercises. And number two is a little disclaimer that if you have got an unstable shoulder joint, for example, you've dislocated it a few times, or you've got quite brittle bones, you've got osteoporosis, or you have this unexplained shoulder pain, you've had it for a few weeks and doesn't subside, it's worth to find a medical, go someone into the medical profession, and maybe they can help you out and give you a diagnosis and see what's going on. So again, it's a simple exercise, but don't confuse simplicity with effectiveness, because it's a very, very effective exercise. So the first part, what we're going to do is we're just going to hang, a partial hang. It's important with a hang that you make sure your hand palms face away from you, so not towards you, it needs to be away from you. Find a bar and hang off it. I mean, you can buy these things of Amazon these days, you can find maybe an open staircase. I'm using the bar here from my dressing room, and you do a partial hang. So a partial hang means that I'm going to shift a bit of the weight from my legs to my arms. Come down here and just do a partial hang like this. Now, this actually might be a bit counterintuitive because it can actually be a bit painful initially, but just bear with me, try to go through it. Only hold it for about 10 seconds if you can't do any longer, and then come back up again. So that's the first thing. Now, what you need to do is, if you can, obviously try to get more and more traction on your arms and less on your legs. So the ultimate goal is to hang loose. But that might take you a few weeks, maybe even a few months to do this. But this is super, super effective. Now, what you want to do is try this for 10 seconds, 15 seconds, 30 seconds, and then make sure you have a minute rest between the hangs. Again, it's counterintuitive, but it's really, really good exercise to do. Okay, so once you've done this for about 10 to 15 minutes in total, just a partial hang, going to a full hang, take your time doing it, 10 to 30 seconds, and take a minute rest in between. You're going to follow this up with some strengthening exercises. Very simple, not too demanding, simple exercises. Again, the other thing is with this exercise, before you do this bit of the exercise, so using the weights and dumbbells, you need to be able to get your arm above the horizon, no added weight, just above the horizon, pain-free. So that's what you need to be doing, that's the condition. So I've got 2 dumbbells here, 2 kg, 3 exercises I'd like you to do. Always make sure that your palms face down. So first exercise is bring the dumbbells all the way up above your head and all the way down. And we're looking for 30 to 45 repetitions. That's what I'd like you to do. The weights that you put on your dumbbell should range between 1 and 8 pounds. If you manage to do 30 to 45 repetitions, that's when you increase your weight. It's also important that you go through your full range of motion. So you really want to go all the way up and all the way down. That's your first movement. Second movement is sideways. So you go sideways, straight up, all the way down, and up, and all the way down. Same thing. Again, 30 to 45 repetitions. Only increase the weight if you get those kind of numbers. And the third one is what we call extension. So arms down, hand palms down, and lift your weights all the way backwards and come back forwards again. And backwards and forwards again. So it's a two-parter exercise. You hang first for 10 to 15 minutes, and then you add a few exercises using dumbbells ranging from 1 to 8 pounds. You do 30 to 45 repetitions before you add some weight. So start lightly and then move on to some more weight. So this is the exercise that we give our patients in support to what we do with the shockwave therapy, the medical acupuncture, loosening up neck and shoulder blades, and some stretches to our patients. Very, very effective, very useful. Please have a go in it. Let me know how you get on. I'm sure it'll be a success. And bye for now. Bye-bye.